Today is the 10th of November 2016. Briefly, let me know what are the reasons why you travel all the way here to find help from us. What are the issues? Number one issue for you is?
Just the numbness. The numbness generally on my arms and legs. Sometimes it seems to be on one side more than the other. Mm-hmm. I've noticed recently it's with these migraines that are pretty transient.
Tell me about the numbness. Would you point to me where you feel it?
Just like mainly my temple and then the forehead area. And,
Feels numb?
And well, at first there'll be like a headache, sometimes an aura type thing that corresponds with it in my eyes. I'll start having these blind spots or zigzags, and then it will just hit me, just suddenly increase, and then I'll feel numbness and just all these various weird neurological symptoms going on.
How long have you noticed this? How many years?
Started back in April
of this year
after a head trauma, sort of a freak accident at the gym.
About 7 months ago. But you had any before that at all?
Never any numbness before. Maybe a few weird type neurological things, but never like widespread numbness.
Okay. It's been all over the body, both sides?
Yeah, it's been both sides.
Okay. I know you have had I remember seeing your medical history. You have had extensive amount of medical tests done. Anything on any of those shown any explanations of why?
They found pretty much nothing.
Okay.
They've done, brain MRIs, multiple head CTs, even when before and during the symptoms were being presented. They've done extensive blood work,
Right. I remember reading a fairly long. I think you had almost 100 pages, something like that. You sent a PDF.
I have it with me, isn't it?
Okay. Now there's a PDF. I read all of them. I didn't read all of them before we spoke. In approximate numbers, approximately how many doctors have you seen? All kinds of doctors. Just give me a number about the number of doctors that have checked into you trying to figure this out.
Including like
all of them.
Like more ER doctors.
Total.
Probably well over 30, maybe 40.
Yeah. 30, 40 different doctors have tried to figure this out. Okay. Yeah. That's all I want to know. How often do you feel this numbness? Is it a daily thing?
It's daily. A couple of weeks ago it was 24/7.
Okay.
And it was always with these headaches. And now it's kind of transient, but it's totally changed my life.
It's not a day that goes by you have a freedom from it.
Not really. I mean, maybe a couple hours here and there.
Okay, not a whole day.
But never.
Okay.
Never.
All right. One, no. Second one, after numbness all over, is what? What's your second issue? I think you said vertigo, dizziness.
Yeah. I get a lot of vertigo, and it's the worst when I'm driving. It feels like everything's shaking and I got to get out. Sometimes it'll happen when I'm walking too, and it'll hit me.
Okay. And when did that start?
I'm sorry?
When did that vertigo start? Also about the same time?
In April.
April, 7 months now.
I've never in my entire life have had the sensation of vertigo or claustrophobia, which I think both are kind of associated, at least for my experience, and never in my life have had those feelings.
Okay. And the doctors were trying to figure a solution for that also.
And they looked at it and they said, they tried to do the Epley maneuver and stuff, and they were like, they can't do anything about it.
Did any of them suggest any other reasons, like psychological reasons?
Yeah, that was the underlying thing they suggested when they couldn't identify a physical manifestation of it. They just said it was all in my head.
Okay. So, after numbness and vertigo, third one. I think it's a fatigue.
Chronic fatigue, just every day. It feels like there's an atlas stone chained to each of my ankles.
What chained again?
An atlas stone, big.
Big. Yeah, okay.
Big,
like an anvil or something.
Boulder, yeah, and it's just like it's a drag to go anywhere, to do anything, to get up. I know there was one lady that said she felt like she was driving around with the brake on. I mean, I totally.
That's how you feel.
That's,
you had to push it just a little bit harder on the gas to go.
Yeah.
And you're only 20.
20 years old.
And you mentioned on the phone, you used to be pretty active, energetic.
Used to work out 5-7 times a week, deadlift 405 pounds multiple times in a workout, squat 300 pounds, full of energy, getting things done. And just all of a sudden just hit a big decline, and now I can't basically go back to the gym or do anything.
Okay. On a level of, if you can put it on a 10-point scale, 10 is so energetic you don't know what to do with yourself. 0, you don't want to crawl out of bed. Most days, when you get up, what level are you in?
Probably 1 or 0.
That close.
Just
okay.
Always looking for
What's
a
the
way out.
Way out at what?
Just way out of going somewhere or doing something. Just can't get out of bed for nothing.
Yeah. Did I understand you were in college but not anymore?
Yeah, I dropped out the year before last. Remember just being plagued by headaches and brain fog constantly.
That's before this injury.
Before the injury.
So you had some of these issues, at least the brain fog and tiredness before.
Yes.
Okay, because I did remember you saying.
And sleep disturbances too as well.
Okay, all right. Speaking of sleep, that comes later.
Yes.
Back to the fatigue. So you start off 0 or 1. What's the highest you ever get during the day?
When it seems like when the headaches go away and the visual disturbances, everything else goes away, and all of a sudden everything's like smooth, and I can just get things done, no more brain fog, and I'd say maybe 7 or 8.
7 or 8 in energy level.
As soon as I eat a meal or something else happens, which I relate somewhere up in here, and the headaches come back, everything comes back, and it's a nightmare, and it's like
Okay.
horrible.
Okay. So that is fatigue. And the fourth one, you mentioned sleep disturbance. So tell me about that. Come a little bit closer to me. That's good. Okay. Tell me about that.
I've had a full diagnostic sleep study done at a sleep lab,
Uh-huh.
and they noticed I have sleep apnea, so some sort of obstructive type of sleep apnea, but they couldn't specifically identify it, although I do have a lot of snoring and my oxygen levels dip down. But they also noticed something interesting, which is I periodically wake up about 3, 4, or 5 times a night.
Mm-hmm.
They can't tell me why, but they have it recorded, and they did all the brain electrodes.
Sure.
and
The
they
polysomnogram.
basically said it's spontaneous, and
Okay.
they relate it to sort of like a all in your head type thing. Like,
Okay. So they didn't have a solution. Usually they put people on CPAP or anything like that. They didn't suggest that for you.
even though it was ordered and I went to an ordering physician for it, they did not even recommend CPAP. They
Okay.
recommended a different route
Which was?
to pursue more of the psychological component that they postulated for why I was having these symptoms.
Okay. So basically the study that you went through, the end of that study, they didn't say, here, this is a solution for you, put on a CPAP or something.
No, it was like another dead end, basically.
Okay,
And
okay, you got it checked out, that's good. And the fifth one is headaches. And the reason it's fifth one is because you had it longer. Okay, tell me briefly, what is the earliest you had headaches?
Probably at least since beginning of middle school,
Okay.
especially when I got involved in band.
Okay.
I noticed.
Where would you have the headache? Point to me.
It would actually usually start with facial pain, and then it would always transition up into my temples and.
Did it go anywhere
forehead,
else?
And it would just turn into a vice on my head, and
Okay.
it could have pain or sensations anywhere else, but this was the pressure point of the sort of the source somewhere up in here.
Yeah.
But
So when you said vice, it would feel like a pressure?
yes,
So-
it would feel like
Where would you feel the pressure? Go ahead.
somewhere around here.
Okay.
Just somewhere around this
Just
area,
pushing down?
temples, and it just feels like people on either side of me just pushing it. That's
Okay.
what it feels like.
All right. So you mentioned at some point you even ended up going to emergency room 2012. Tell me briefly what happened and what did they find and when was it?
That was somewhere during the school year, maybe fall of 2012. That was why I was having braces.
Your braces are from 2010 to 2013.
Yes.
So this is like a couple of years through braces.
Yeah, they were done at a popular orthodontist in the Dallas area, and suburban Dallas area, Fire Mound. And they, I just remember that day, it was so bad. And it's almost, I learned to just accept it after that, especially after that, because they took me in, they did a head CT scan, and they found nothing, absolutely nothing. But the pain level I had was either 8 or 10. It felt like an emergency.
Mm-hmm. You went to the emergency room.
I had a headache that bad before.
And you mentioned it felt like ice pick or something?
Yeah, it felt like, my dad brought up, maybe could be cancer, we don't know. All I know, I was telling my parents is I'm in a lot of horrible pain right now, and I might have had the auras going on too that made it even more disturbing. So.
Okay. All right. And I'm sure with the headaches you've seen other doctors as well.
Yeah.
Okay.
And they just disregarded it, and said that, it can just take some ibuprofen or NSAIDs drug, non-steroid anti-inflammatory drugs to take care of it. And, I just learned, eventually I stopped taking any drugs and just learned to deal with it. And
Okay.
it just kept building in the background.
Okay. So if you find reasons why you're having some of these and why maybe the 30 doctors have not seen, maybe you find something and find a solution, it'll be kind of better.
Absolutely.
Okay. Good. Let's see if we can do that. Thank you.